All right. So today we're going to talk about types of play. All right. Now, this is important. And what is happening here? Sorry. Bear with me. Not sure what exactly is happening with my all right, there we go. All right, so play is, when we talk about play, it's really important because it builds up a lot of skills. It not only helps the child, the kiddos, start to put things together and problem solve, but it helps with socialization. And socialization is important because we want to know how to communicate. We want to learn how to communicate things a little bit more efficiently than, if you remember some of the videos a couple weeks ago about children throwing tantrums, right? Because that comes out of frustration when children aren't able to articulate what they want and get what they need in order to move past that. So these intricate learning processes occur, and that usually happens through play therapy. And play is really essential for a healthy and happy child development. It helps kids to develop those wide ranges of skills and understanding that we talked about. And playing children really reflect what is important in their lives. Okay, so builds communication skills, helps with learning, all sorts of great things. And it can take several forms, and it changes as children grow a little bit older. It could be indoors or outdoors. It could be quiet and loud, clean or messy, and even funny, or maybe even thoughtful. Okay, so a wide range of what they can do with play and the skills that they build from that. So children play for different reasons. They can explore to learn new things, or it can be to consolidate or improve skills that they've learned previously. And sometimes play can be a way of developing, like I said, those social skills. So kids bring their own experiences and beliefs to their own play. And we talked about the individual and the microsystems and the macro systems, right? They start exploring those systems through play, right? And you think about that. Children that may play house or play cops and robbers or something, they're acting out what their values are and what they've learned in their family systems, and those much smaller scale systems. So if you remember Jean Piaget, right? He was one of the pioneers on child development. He found that kids learn step by step through experimenting and interacting with the world around them. In other words, kids learn through hands-on play, right? And if you remember, I think one of the terms he coined, let me write this down. So Jean Piaget, I'm not going to go too much in depth because we did cover this in previous lessons, but he looked at children as little scientists, right? So their minds were just poised to explore the world around them, interact with the world around them, and figure out new ways to do things more efficiently, right? So as we mentioned, he was a pioneer of child development. He found that they do this through gradual steps. And one of his limitations were that it really covered up through about adolescence, right? Everything up till about 12 years old, and a little bit beyond that when we get into concrete and formal operations, right? Though it doesn't really go beyond that. So it was very specific to children. So just to recap what some of those stages were, right? We have our first one, which was sensory motor stage. Right? That's the first one. During that stage, if you remember, babies are aware of their own needs and sensations, and it's captivated, and they captivate all these new experiences that their bodies are having, and they explore through touching things, through putting things in their mouth, through kicking, pushing things around. Hence the name sensory motor stage, right? Actually, I think might have spelled that wrong. Should it be sensory slash motor or sensory motor, whichever you want to do, with an I, not a Y. The next one, and that occurred right around, a couple months really, I'm going to say birth to 2 years old. Okay. The next stage, if you remember, was what? The pre-operational stage. During the pre-operational stage, things got a little bit more intricate with their thinking and how they interact. If you remember, mental images, processing images, they start developing words and concepts. These are really one of the things that toddlers do during the stage, but they can't really do anything with them yet, as they really don't have any control over them. Pretend play is going to be really focused on this stage when we look at with Jean Piaget. Okay, so we're going to look at this in depth from about 2 years to about 7 years old during our talks on play in the pre-operation stage. Okay, but this is where they start manipulating some of those mental images and conceptualizing things and trying them out. Remember the scientists in them. They're trying them out to see how they work and how successful they are. Based on how successful they are, that's when they reinforce that behavior and try and apply it other things, which moves us to the concrete operational stage. Concrete. And this stage, operational, this stage happens from 7 to about 12 years old, right? And if you remember, at this stage, children are able to develop logical thought about an object, but only if they can manipulate it, right? So games and rules, they really dominate this age group of children, okay, during the concrete operational. Haven't really grasped abstract yet. They're not really testing hypothetical situations until they get into the formal operational stage, okay? And that happens from 7 years old plus, okay? And from here, children are able to really think in abstract terms about the world around them, concepts such as future. They start developing their sense of moral right and wrong and their values. They're a little bit more fluidly understood at this stage, okay? So again, that's just a recap of Jean Piaget. Now that Jean Piaget did a great job at kind of showing how, and we can test this throughout cultures, many cultures. And it's roughly around the same ages for just about every culture that we see children go through similar stages, right? But there are limitations to it, right? He really doesn't talk a whole lot about social interaction, which is really what we're going to expand upon today. So while play is often seen as something like frivolous that children do to pass time, play is an incredibly important part of a child's healthy development. Play is the child's work, if you think about it that way, right? That's their full-time job. Through play, children learn academic skills like math, they learn science, they improve their reading and their language and literacy skills. They learn social skills like effective communication. They are able to resolve conflict a little bit better, right? Problem solving and cooperation is a big part of, especially when they start playing cooperatively, which we'll talk about here in a little bit. But most importantly, they learn about themselves. They get to know their personalities, including what they like and what they dislike, what their strengths are and their interests are. And through play, children learn where they really fit into the world. So it's very, very important that we promote that with children that we're working with, or even many of you that have children of your own. Okay. So this all started, so types of play, your book covered 6 of them. Now, many of you are going to be going on to educational tracks and maybe even psychology, child psychology or something like that. And there are a couple theories out there that suggest that we can break these out even more. But for the interests of our lesson and what the book provides, we're going to talk about types of play, and there are 6 of them for today's lesson. So this was really coined by a researcher named Mildred Parton, who identified these 6 stages of play that children really progress through, okay? And it's important to note that each child develops at his or her own pace. So children of the same age may not show exactly the same types of play that their counterparts are. Okay, so let me put that name up just so you have that. So Mildred Parton is really the founder of these six types. All right. So similar to some of the other developmental theories that we heard, they progress through stages and we can observe them. So these are what they observed, Parton observed anyway. So unoccupied play. So this happens right around birth. It's about 3 months old is usually where we see this, okay? And children are relatively still in this type of play. Their play appears to be pretty scattered, and this type of play builds the foundation for the other 5 stages of play. Unoccupied play looks like babies or young children. They're really just exploring materials around them. They're shuffling things around without any really sort of organization. Okay, so very unorganized. And I'm going to use the word purposeless. Okay. Because it doesn't look like there's really any purpose, and it looks very much like the first stage, sensory motor stage of Jean Piaget, where they're just exploring, maybe putting things in their mouth, moving things around, picking things up, throwing them. This really allows children to practice manipulating materials and mastering their self-control and learning about how the world works. Okay, so the second type of play as we progress is solitary play, okay, where they play by themselves. And we usually see this happen from around birth. It might evolve anywhere from that birth to 3 months. So we're not going to really put a time limit on that, but we'll say birth to about 2 years is where they really sharpen their skills in solitary play. Okay, so we see it a little bit more purpose. This type of play occurs when children entertain themselves without any social involvement whatsoever, no other children around, right? So children in solitary play may not notice or acknowledge other children. Adults might worry that children are playing alone, but they're actually, solitary play is very, very normal. So there's really nothing to be alarmed about that at this stage, right? When children engage in solitary play, they're able to explore freely. They're mastering their new personal skills, like moving things with finer motor skills and cognitive skills, and preparing themselves to play with others. So we're going to call this kind of a preparation to play with others. Kind of what happens in this stage, right? Because they don't have the social skills yet. They might. I'm not saying that can't happen before 2, but usually prior to 2, looking into the pre-operational stage, that's usually where they're starting to sharpen those social skills. Okay, so that brings us to our next skill, which is the onlooker play. Now, what this this usually happens about 2 years, 2+ years, okay? Starts about 2 years. And children who sit back and engagingly watch other children play, it might be their siblings, but they haven't really joined in that play yet. So they might just be sitting there watching their siblings or older brothers or sisters running back and forth or playing with toys or something, but they're not really manipulating anything, right? So the active part of their play is just simply watching others. And sometimes it's easy to think that children are engaged in onlooker play when they might be lonely or scared to engage other children, when in fact, this is a very normal part of play development. Just as adults, people watch. How many of you people watch? You go to your favorite restaurant or coffee shop and you sit there and just watch people. I love doing that. I don't know why. My wife and I have a game where we try and just come up with stories just based on what people are doing, you know, and it's just a fun little hypothetical thing, but that sparks imagination, that shows that they're interested on how people are interacting. And if you remember, children are like sponges. They absorb everything around them. They look to the adults as their role models, and they really model their frame their thoughts around how they see other people interact. But they learn about social rules of play during this stage as well, during this play. They learn about relationships. They explore different ways of playing and using materials, and they learn about the world in general. So again, very, very important part. So this is kind of the observer phase, okay, of play. All right. So bringing us to number 4, parallel play, okay. Parallel. And we usually see this happen, again, probably around the 2-year mark and up. Yeah, these aren't hard and fast rules here. But during this play, during parallel play, this occurs when children play next to each other, but they're not really interacting together. For example, you might have 2 children that may be driving cars on the carpet next to each other, but their play doesn't really overlap with what the other one is doing. In this stage, children are not really engaging in social exchange. So think of this stage like a warm-up exercise, if you will. So children work side by side on the same activity, practicing skills and learning new methods to engage each other. So now we're kind of, we've moved from observing to practice play, okay? So that's what we'll call this one, practicing. Practice to play with others. And that moves us to our next type of play, which is associative play. And we can usually see this happen right around 3 to 4 years old. Okay. Now, during this type, during associative play, this type of play signifies a shift in the child. Okay. So instead of being more focused on the activity or object involved in play, children begin to be more interested in others and how they're playing, right? So associative play allows children to begin practicing what they observed through onlooker parallel play, and they start to use their newfound social skills to engage with other children or adults during this activity of exploration. So during this one, it's not necessarily practice, but we're going to see communication. Okay. So the real big difference in self-talk. Okay. We're going to see a lot of self-talk during this. So the real big difference between the parallel play and associative, they're both practice play, but the difference is now they're starting to vocalize what they're doing. They might be using vroom, you know, making sound effects as they're racing their cars, or talking to their dolls or figures or whatever, while the other child is around. So kind of taking it a step further, instead of just playing with something in front of them, they're now vocalizing, still not yet quite interacting with others until we get to the 6th type, which is cooperative play. And this is probably the most observant. This is what we observe the most. And we usually see this 4 years plus. Okay. So very iconic, very easy to identify. This play is categorized by cooperating efforts between both the players or multiple players. So children might adopt group rules. They're expanding a little bit more. They're establishing rules for play. And it's important to remember cooperation is really an advanced skill, and it can be very difficult for young children, or even if you're working on your group projects. I think it's tough to cooperate sometimes, isn't it? So ironically, cooperative play often involves a lot of conflict, and this is normal. It's sometimes difficult for young children to share and take turns and negotiate control in these types of play scenarios. So you can support children. Like if you're working with children, either in a classroom or in a therapeutic setting, or even in your own home, you can support children engaged in cooperative play by staying close and helping them learn healthy expressions of emotions and teaching them about problem solving skills. All right. So those are the 6 types of play that we've identified. I do want to highlight again cooperative play in resolving those conflicts because it's really important to understand that a lot of parents or caregivers or educators sometimes get it wrong, and how they intervene in conflict could have lasting effects on how children learn how to conduct themselves properly. Okay. So for example, I was working with this family once, and it was 5 and 7 were their ages. And what was happening was the younger son, it was a boy and a girl. So the son was 5 and the daughter was 7. And this 5-year-old was just really, really smart, and was able to, turn on the charm. He was just very charismatic. And what we were noticing is that he was prompting, he was enticing the daughter, the girl, his sister, to hurt him. It was kind of mind blowing to kind of see this transpire, but he would do something deliberate to get her worked up, get her angry. And then what did the parents do? What do you think the parents did? Put her in timeout, right? Removed her from the situation. And then what does he get? He gets to play all by himself with whatever toys he wants. So what the parents were doing, and it took a little bit for me to talk to them and figure out a way for them to observe this happening and keep them from doing that, because they were rewarding him inadvertently for acting out and causing her to react. So what we did is we worked with the parents to come up with a way to, first of all, observe when this happened. And what we did is once there was conflict with those 2 children and the parents had to get involved, they removed everything. Okay. And they sat them down, they explained to them what they could have done different. So we turned that into a teaching moment, and we were able to successfully turn that around so that the 5-year-old, when he knew that he was causing conflict and conflict was going to happen, that he wasn't going to win anymore. So not necessarily being punished for conflict, but just not being rewarded for causing that conflict, if that makes sense. So anyway, it's very important to figure out how to react to that and to guide that into a learning behavior so that we're not inadvertently rewarding somebody for something. So I just wanted to bring that up because that's going to be very important for many of you as to how to resolve these conflicts, especially when hitting or the threat of injury might occur between siblings or school children or whatever the case might be. So what are some ways that we can support children through these 6 stages? Okay. So supporting these is very important, right? Because children want to play. It's their full-time job. They're almost wired to start exploring the world around them. So it's up to the adults and the caregivers and the educators to figure out a way to facilitate that in a way that's going to be healthy and supportive. Okay. So the first thing we're going to do is set the scene. Okay. What access do we want the children to have? Okay, what access do we want those kiddos to have? Create opportunities for the child to explore, whether it is pulling out fun new materials, or taking the child to the museum, or simply walking around the block, helping the child to discover new places and materials for people to interact with, because they might get bored of the same old blocks, or they might get bored of the same cars or dolls or whatever. And play might become stifled, and their interaction, they might not be interested in it as much. So giving them as much as possible to explore, give exploring opportunities. Okay. So that's one way that we opportunities. That's one way that we can do that. The other thing we can do is hold on to our expectations. Now, what do I mean by that? Because we all have ideas, hopes, expectations. Oh my gosh. Expectations. So hold on to our expectations. So instead of worrying about how you think the kiddo should be playing or what you expect them to do with a certain toy or in a specific situation, let the child decide, right? Allow them to explore whatever it is their imagination comes up with. When children have control of a situation, they learn to listen to their own cues and promptings. And that makes learning developmentally appropriate for them and also a lot more fun and engaging if they are able to guide their own imaginations, okay? All right. So that's an important one, right? And the third one that we can consider doing is support and guide. So we may have, again, going back to the expectations, we may have ideas of what they should play with or what they shouldn't play with, but just kind of letting them explore what they want to play with or how they want to play with it is really important. However, some things might come up that might be maybe a safety risk, or it might be a threat to injuring themselves or somebody else, right? So just like parents support a child learning to walk by providing steady hands when needed, being present and engaging in the kiddos' play gives opportunity to support them when they need it, okay, or when they ask for that. The child might need help learning a new skill or emotional support exploring a new environment, or they might need new ideas and inspiration from their most trusted adult, either albeit their mom, their dad, or uncle, or whatever, right? And as the child grows and develops, their support becomes a little bit less as they become a little bit more independent. All right, so just like adults need education and resources how to learn to be good at their jobs, children really need that same support of their job of playing, along with practical materials like giving them the toys and games and whatever encouragement they need to have lots and lots of playtime. Okay, so any questions on play, types of play, or how that fits into their development? Because the next thing I want to cover, let's see how we're doing on time. Okay, I think I have enough time to do this. So the next thing I want to cover is screen time. Okay, so this is something that has really we've looked at a lot of research probably over the last 10 years, because screen time is becoming more and more prevalent with the advent of technology, right? Everybody's got an iPad or an iPhone or something like that. And not every child does, but I'm using that kind of sarcastically. So screen time. It might be television. It might be laptops. It might be iPads or other not promoting Apple in any way, but other tablets. I say iPads because I think that's just like the common term. So it's a very common topic in today's world. And when you think of all the gadgets that have screens, it makes sense that there would obviously be some concerns. I mean, we got screens in our cars now. We have, they're just everywhere. But does too much screen time really affect our kids? Okay. So controlling screens can be rather tricky because they're everywhere. According to research, we should probably be paying more attention to the effects screen time can have on kids, especially little ones under the age of 5. Now, what about age 5 is really significant, you might be asking. Early childhood is a period of rapid development. And as they get a little bit older, they start, as we talked about with their play, they start interacting with the world around them. So this could be problematic if we expose them to the luxuries of screens earlier on. So why should we adapt our lifestyle to reduce screen time when it's all around for our kids? Well, let me give you some reasons why. First one is screen time is less green time, is what I like to say. Less green time. What do I mean by that? What's green time? I think we had somebody in this class do a report or presentation on green time, right? So the first reason really is kind of a no-brainer, but sitting in front of a screen means that kids are not paying attention to the world around them. Nature plays a big role in how they deal with everyday life. Remember that fuzzy knowledge, their development of physics in the world around them, right? So have you ever really felt stressed out and went for a walk along your favorite beach or whatever and instantly felt better? That's what we're kind of promoting here, is getting them to walk, get energy, get sunlight. It's really, really helpful for them to be in nature. So when little ones interact with nature, it's been proven to help lower stress, as somebody presented, reduce aggression, and it can help them focus later on. So, which means more time in front of a screen, less time getting that experience to those natural mood enhancers and making a good habit of playing outside. In fact, experts go on and they say that screen time can do the exact opposite of what nature does when it comes to aggressive behavior and focus. Where nature calms and relaxes, too much screen time can actually increase stress levels and create a feedback loop of depression. So, I think many of us might be exploring that with Zoom burnout right now, right? So you might know what I'm talking about here. But not only when the child's ability to focus is thrown off, they can't deal with the world around them properly, which might cause them to act out a little bit more often. And there have been studies that show that screen time takes up a large amount of the child's mental energy. So they don't really have a lot of energy for anything else. So one fast and easy way of restoring that lost energy is to become angry, which they eventually turn into their way of coping. So becoming angry will give them. So I'm going to actually list that. So increases outbursts. Okay. So they're burning off that energy, right? That energy that they crave when they need it. So in other words, you can expect more meltdowns, more reliance on that technology. So if you start to curb that technology, you might see some blowups from that. Too much screen time can make kids sad. Okay. Increase sadness. And that happens. All right. They might become sad that when their young brains are developing. The studies show us that exposure to screens can and probably will have a negative impact on that. So mainly when it comes to video games, at least, right? Because again, they're using a lot of that mental energy and they're not interacting with the world environment. So this targets kids who are most likely between the age of 8 and 18 and have regular exposure to screens, which is really about 7 or so hours a day, right? So that's what the research has shown. The main side effect of too much screen when it comes to addiction and gaming are reported as emotional processing, decision-making, cognitive control, and the ability to focus one's attention, okay? Now, that's not to say that games are necessarily bad. There's a lot of hand-eye coordination, but figuring out a way to guide that is really most important so that it's not too much, right? We don't want too much of a good thing, right? I guess is the lesson here. So not only that, but games flood the brain with feel-good chemicals known as dopamine. All right. And the problem with all this dopamine on a regular basis is dopamine is our reward accelerant. It's the chemical in our brain that makes us feel good about what we're doing. We get that when we eat. We get that when we have certain chemicals introduced in our body, like maybe nicotine or caffeine or something like that. It makes us feel good. So getting tired and worn out way faster than they should be, which again doesn't leave a lot of room for forget what I was going to write here. So anyway, this means that kids affected will have to work a lot harder to feel happy, kind of going back to that sadness point that we made. So screen time reduces dream time. Okay. So what do we mean by that? Remember when we said that we're letting children use their imagination, reduces dream time. Letting kids use their imagination is significantly hampered when they're using screens too much. We're sure at one point or another you've heard about how your phone can be detrimental when it comes to sleeping, especially if you're glued to Instagram, right? So sleep might be affected. So I'm kind of using this as two things here. Not only is the blue light affecting their sleep, right? Just 2 hours on their device at full brightness can suppress the hormone that helps us fall asleep, known as melatonin. Melatonin is our natural body's chemical to help us feel sleepy. And if we don't feel sleepy, we're not going to get enough sleep. Chronic disruption of our circadian rhythm, which is our body's natural sleep and awake cycle, can cause some pretty serious health concerns like obesity, or even it's been linked to diabetes or irritableness, which could affect behavior in school, right? Cognitive functioning as well. So a lot of things can come from from lack of sleep. Okay. So all these things are really scary. So what, and the other part of this part of dream time is reduced imagination. Because everything's programmed. Everything's programmed into the games and into the iPads and whatever it is that they're engaging in with these screen times, or even the videos. So while they are getting these stories and they're following along with them and they're actively engaged in them, they're not coming up with it, which could stifle creativity, energy, and just that imagination, using their imagination, which we want, along with later on maybe even critical thinking skills and judgment, which we all know is very important. So these are really some pretty big things to try and combat the technology that we have today. So what can we do? What are some things that we can do? We can have schedules. We can continue to do research, right, to limit screen time. Okay. My professional and personal opinion is, prior to the age of 5, limiting or really eliminating any screen time. Avoid allowing them to sit mindlessly in front of the television. Now, there are some television programs that I think are very useful for boosting creativity and helping them learn with numbers and shapes. Of course, nothing beats the one-to-one interaction with a baby and showing them numbers and shapes and objects and helping them with language. But there are some great programs out there that are helpful, but limiting them to a very minimal, maybe 30 minutes a day, from age 3. Prior to that, screen time is really useless. But definitely prior to the age of 5, it should be almost eliminated, if not significantly reduced. Okay, so things like strollers and avoiding putting things in strollers, or if there's something, many people have minivans or trucks or vehicles that have screens on the back of their headrest or something. And it's tempting. It's really, really tempting because they're everywhere, and kids like it. They suck it up, they soak it up, and they just they're quiet. And that might be a reward for parents, which is very, very dangerous, right? It's a slippery slope. So as kids get a little bit older, we want to give them a little bit more freedom to decide what works for them. But again, once these boundaries are established earlier on, it might be a little bit easier later on. So encouraging parents to start setting up boundaries and thinking about this ahead of time, before the children do get addicted, before they become engrossed in having those screens around all the time. Because when they don't have them, that's when we're going to start seeing backlash and start seeing outbursts and stuff. Okay. So one of the things I like to do with families is coming up with unplug time. Lots of people have a day that they try not to use technology, right? So promoting that, because it's not just the child that we're looking at the family system here too. So having having a period of like a day or two where we say no screens, no television, no iPads, and that gets some of the older kids invested in this process and this tradition as well. And bringing out board games or playing with blocks or doing something that doesn't involve screen. That could be something that they could consider doing. Okay, trying to think here. Every household is different. I know it's hard because we have parents that dual work, and it's hard to really enforce these. But thinking about these things earlier on really does help to confront issues and bad behaviors down the road. Okay. So what are your thoughts? I'm going to stop sharing my screen here. Speaking of screen time, what are your thoughts on screen time? How many of you already have like some kind of limit to yourself, or maybe your parents have had some kind of limitations that you care to share growing up?
When I was younger, I remember it was either my mom or my dad. It was one of them. They would tell me or my brother or both of us to take a break from watching TV and do something else. So for me, I would like read, and that's about it. I would read or I'd like go outside.
Okay. So they allowed you to use the technology, but they had boundaries, like we talked about, boundaries in place, saying only so much time, like a schedule almost.
Yeah.
Okay. And that's a really effective way. Yeah, absolutely. Anybody else have a similar experience or another experience they care to share?
I do that with my own kids. They love screens, and even on car rides, they always ask to use my phone or a tablet. And I don't give it to them. I tell them to look out the window, and they're like, "This is so boring." I'm like, "Well, let's play I Spy or look at the leaves changing color." And I'm like, "This is what I used to do when I was in the car." And they're like, "Oh my God, your life was so boring." But yeah, it's basically just trying to like do limits. Like even right now, my son is on lunch/recess, and he wanted to jump back on a game. And I'm like, "Why don't you go outside? Go outside and play."
Yeah. It's good for you, by the way. I mean, that's great that you're able to enforce that, because it's such an easy, slippery slope for parents. They want their kids to be happy. They don't want them crying. But at the same time, we're really giving them a drug, is what we're doing at a young age, and we're rewarding those behaviors, and they get addicted, and it as all those reasons that we talked about, it could be detrimental to their cognitive development and their social growth, which we don't
Yeah,
want.
I mean, I can definitely say I see the addiction side of it in my kids. And it was something me and my husband used to argue about a lot, because he's a gamer. So he'd be like, no, it's fine for them to have games. And I would see it's like trying to get them off of it. It was such a struggle, and it was a fight. And I could just see they didn't know what to do with themselves when they didn't have a screen in front of them. So then I was like, we need to stop this. So then we started doing like limited times.
And I'm sure you're aware that you're doing this, but what you're doing is you're setting the stage for future issues that might come up, because you're already putting into place these practices. Instead of, if you can imagine, if this went unchecked until the child was 10, 11, or 12, and they're just constantly on that game, can you imagine the impact it's going to have on that child when you start to try and put those safeguards and those boundaries into place? It's going to be chaos, right? It's going to take a lot to overcome that. And there's going to be a lot of backlash. There's going to be a lot of outbursts, which we want to avoid. So thinking about this earlier on, and many of you that are going to be counseling parents to be, or working with children at a young age, start thinking about how you're going to have this conversation with those caregivers, because the earlier the better with this, right? I'll share with you this came up for me, no kidding, just this week. I had a friend of mine post on social media about how my generation, which is 70s, 80s, I grew up around the 70s and 80s, we went outside a lot, and we weren't into gaming as much as the kids are today. And it's a really generational thing. And I thought about that, and what really kept me from engaging in video games, kind of like what Felicia and Quamir, you both had indicated, is that my parents didn't have any kind of games growing up. Right? So they really did not promote. In fact, my mom was very much the same way. We had a certain amount of time a day, and we had to turn it off. If we didn't turn it off, she would take the cord or hide the controller for a day or two, just to promote us going outside to do. And if we gave her any kind of difficulty with that, she would tell us, find something to do, or I'll find something for you to do, which really motivated us to getting creative and using our imagination, because we didn't want to pull weeds in the front yard, right? So, granted, we're probably not there, because there's a lot of educational things with technology that we can use, but again, just getting them to be creative. But anyway, my point in that is, I think it's my generation that's really promoting the increased use of screen time, right? Because we don't want the conflict. We don't want children screaming. So we might be a little bit more liberal with giving screen time. So anyway, yeah, that's all I have for today for my lecture. Were there any thoughts? Anybody else care to share anything before we depart today?
For the assignment, I know it says to avoid using television, social media and stuff. I read like different things on 2 different apps. Are those okay, or should I avoid those too?
Well, and that's hard. I'm going to say do your best, because I don't I don't want you going to your other professors and saying, Dr. McMunn said I'm not allowed to view your book this week.
Oh.
So use your best judgment. Avoid games. See if you can avoid the Candy Crush or whatever it is that they are, Bubble Blast, or Groundhog Smash, or whatever. I don't know what. I'm just kind of throwing out terms out there. Do your best. I'm not gonna. Don't put your grades or work or anything in jeopardy just by shutting down. If you can, do it and see what the effects are. I mean, the purpose of this exercise is to see what it's like for you to limit that, because that's going to share with you. I'm going to share with you another story here. I was counseling a young female. A teenage girl, and she was 15 years old, and she had she got on social media with her phone, and her parents turned off her service and took her phone. And we saw out of this probably a backlash of behavioral issues. She went through anxiety, like severe anxiety, just not knowing what her friends are doing and what's happening out in the world with her social. I mean, there was just so much wrapped up in that phone that it was unreal. We had to start treating an entirely new condition because she lost her phone. So the purpose of this is to see what that's like. So you have some kind of awareness of what it's like to pull that screen time away. And that'll give you time to really evaluate how addicted we are to this stuff. I was speaking for myself, it's hard for me to shut down sometimes, but learning how addicting that is, that's going to help us really answer some of these questions when we're trying to guide these behaviors with children. Okay. So that's really the point of this exercise. So use your best judgment. I kind of took a really deviated turn from this, but use your best judgment in doing this assignment this week. Okay. All right. Any other thoughts or questions? All right. So I think I covered both topics. I don't necessarily have anything for Thursday. I do have a couple students that wanted to meet with me one-on-one. So we won't have any lectures on Thursday, but I will be available to talk with you one-on-one if you have any questions about grade projects or whatever. So again, if you're planning on doing your presentation live, sign up on D2L no later than tomorrow midnight, so that way I can get everybody scheduled by Friday and we know who's doing what and when. But other than that, that's all I have. Have a great rest of your week. If I don't see you, have a great weekend, and we'll see you all next week.
Yeah.
Thank you.